Welcome to Successful Philanthropy. I'm your host, Jean Shafiroff, and today's show is all about Stony Brook Southampton Hospital. With us today is Mirella Cameran-Reilly. She's head of branding and marketing for Stony Brook Southampton Hospital. Mirella, thank you so much for joining us. And I understand the hospital has put together a whole program before the holidays to help fund not only the hospital, but to help local businesses here on the eastern end of Long Island. And I know our viewers want to hear all about that. But before we go into that, I'd like you to talk a little bit about the hospital and the extraordinary job that has been done during this COVID-19 pandemic to help not only the patients, but also to inform the community on how to live their lives. And so on that note, what exactly is going on right now at the hospital?
Well, we are very, very pleased that we were able to deal so well with the height of the pandemic, and we had some excellent numbers in terms of the infection rates. No one was infected by coming to the hospital, and the infection rates amongst people within the hospital was lower than the community, which means to say based on antibody testing. So what that means to say is that we felt safer inside the hospital, where there was less of a virus, than we did outside the hospital. So people were scared to come to the hospital for other reasons, for routine reasons, or even for emergencies, because they were worried about catching, obviously, understandably, contracting COVID. But actually, we have a very safe and secure environment with multiple layers of sanitation and protection to keep all our staff and our patients and the patients' families, all of them, as safe as possible.
And that is very, very important. And as a board member of the Southampton Hospital Association, I have had the fortune of being in on many, many calls with Robert Challoner, the president of the hospital, who has really been an amazing leader during this time. And so I know that the staff has done an extraordinary job. And I remember when at our summer gala, we honored all the frontline workers at the hospital. And so it's really wonderful to hear that the hospital is keeping a very safe environment, not only for someone walking into the hospital, but for its staff. And the staff is just they're invaluable to all of us. And I'm so glad to hear this. Now, I understand that there were a few deaths, but that the mortality rate at Stony Brook Southampton Hospital was much less than state and national averages. Can you discuss that a little bit for our audience?
We were really pleased to see that because the mortality rate was a lot lower, including other hospitals on Long Island and in the city. So that was that took a lot of creativity and working together as a team. It was a very novel, it's a very new situation that we were dealing with, and so the clinical staff had to be very creative and very thoughtful about the different ways to cope with that. And they tried a number of things, and the algorithms that they developed really seemed to have great results. So that was really a great testament to their expertise and their creativity and their working together as a team and really pulling together. And, for a smaller community hospital, those results are nothing less than spectacular. So we're also grateful to Dr. Weinbaum, who's our Chief Medical Officer and our clinical leader, and all of the staff, working together, pulmonologists, the respiratory therapists, the emergency physicians, the environmental services, making sure everything is extremely clean and sanitized. It takes everybody to make that happen. But the results were great. They really were.
Yes, and I think the staff of the Stony Brook Southampton Hospital has really been extraordinary during this pandemic. And I personally want to thank everybody who works at the hospital, all the frontline workers, for the amazing work you've done. And thank you so much. And really, you are our heroes, and we honored you this year, but we want to honor you every year for the things that you've done. You've really put your lives on the line. And so I thank you. We all thank you. And now getting back to Mirella. Mirella, so I understand there was a shortfall in finances because of the hospital being closed to certain types of procedures, mostly elective surgery and elective procedures. And how has the hospital coped with that right now?
Thank you for asking that. Yes. Well, there's the one side is the shortfall, and then the other side is the huge expenses necessary to cope with COVID. You know, obviously the supplies and the devices and the staffing and everything that needed to be purchased or obtained in order to fight COVID. So it's a bit of a double hit.
Yes, but the hospital had a COVID-19 fundraising drive, and I understand about $2 million was raised, but that money was desperately needed because when you're in a situation like this, I understand a lot of respirators were purchased and ventilators, I should say, and then masks and proper equipment, and
Correct.
So important for the community and for the workers. And really, you've done an amazing job. And I didn't want to interrupt you, but moving forward, there's a constant need for money, correct? And that shortfall still has to be made up for. And I understand you have a very special program going on now for the holidays, right? And
we do.
Hampton Holiday Shop.
Can
you tell us a little bit about the Hampton Holiday Shop?
I'd love to. I also just want to make sure that people appreciate that we are, and I'm sure they do, that we're through the peak, which is great, but we are seeing upticks definitely in the city at Stony Brook and coming now out further east. So we've really, really invested in testing, and we have the testing drive-through site at Southampton Hospital. We have the one at East Hampton at the high school, and we've turned those COVID testing sites into respiratory evaluation centers. So if you have symptoms, you can go and be tested for the flu, for COVID, for strep, so that we can find out exactly what is going on and treat you. So hopefully that will reduce anxiety, and obviously testing is also key to containment. So we're still investing in those sorts of services, and we're also investing in making sure that we are fully stocked and supplied. We really know that the precautionary measures work. We know the science with the masks and the hand washing and the social distancing, they work. So our advice is we have to stick to doing those things because it benefits all of us. But at the same time, we are making sure we are completely prepared if we do see going into the fall and into the flu season, if we do see an increase, we will be prepared to take care of everyone. And one of the things we're so grateful is that we were never overrun. We always had enough supplies and devices and ventilators. We had enough equipment and enough people to take care of every single patient. And we are absolutely committed to making sure that if need be, we will be in that position again. So, and we were really able to do that because the community was also incredibly supportive. As you mentioned, the Healthcare Heroes Fund was wonderful. The donations to that were amazing. But every single day, people just showed up with all kinds of things, from breakfast, lunch, and dinner to gowns they made at home, to financial checks, donations to us. The community completely rallied around.
And I remember that if someone wanted to buy lunch for a group of workers, it was something we could do. And I remember participating.
You did,
and
yes.
It was a nice thing to do. And then also to help out with the fundraising, which is so important, and then to give. Now, so wearing a mask, I know we don't have masks on now, but we are social distanced, and that's really key. But my family takes this very seriously, and most of the people that I know take this very seriously. And so our viewers, all of us, we have to take this pandemic very, very seriously. We must wear a mask. We have to continue. We can't get sloppy. And if you're at a cocktail party, a small group, I say keep your mask on. You cannot assume that anyone is safe because you're in the same circle of people every week. People go back and forth to New York. They move around. You never know who anyone is in contact with. So keep that mask on and make sure you keep washing your hands and social distance. As Mirella is telling us, Mirella Cameran-Reilly from Stony Brook Southampton Hospital, which is what our guest today, who is just a great woman and really giving us some valuable information. And so now with the holidays coming up, and even though many of us are home most of the time, we do go to restaurants generally with small family group or one or two friends that we might trust. And I think it's very important to support restaurants during this time and to continue to order food in from the restaurants so that their business continues. What about the holidays? And for many people, they've lost jobs and it's a tough time. But if people want to give a gift, and it doesn't have to be a massive gift, but most people want to give gifts, they can also support the hospital through this Hamptons Holiday Shop, correct? And
That's right.
You're here to talk about this, Mirella, and I
Yes.
think it's a great thing. And tell us a little bit about it, please.
So as I was saying, the community just came and supported the hospital. And so
So important.
So
I can't think of
wonderful.
anything more important to support in this community, especially now, but in general than the hospital, because as I've said to the audience before, without a good hospital, no one will want to live in a community. And the Hamptons has often been thought of as the playground of the rich and the famous. Well, it's our obligation to support the institutions here, the hospital being number one.
Thank you. Yes, it is. I think people have also. I think it's been very clear to everybody how important it is to have local care and access to local care and access to high quality healthcare right in your community and also to know what's going on in your community.
And also, if you live in a community, you must support the community philanthropically, and then the businesses that are here to come here and not to do that is a big mistake. So you're encouraging people to do their holiday shopping here in the community, and when they buy from different vendors, a percentage of the sales proceeds will go to the hospital. Is that correct? So tell us about that.
So
it's very interesting and exciting for someone like me. I can see myself going into a store. Are you participating? And if they say yes, all the more reason why I want to do more shopping.
Well, I hope lots and lots of people will be like you, Jean, and think this is a great way to give back to my community, to support my community. So it's basically starting November to December. It runs from November to December. And if anybody is shopping during that period for any holiday at all, please consider a local business. I know it's really easy just to, press that button on your keyboard and order something online, but there's gorgeous shops, gorgeous businesses all the way from West Hampton to Montauk, these independent retailers and also...
And they need the business now.
They need the business.
It's more difficult to be an independent small business than to be a massive chain.
It is very difficult. Retail's tough. We're uncertain about the fall and the winter months, but how can we support this community? And so we've got the Hamptons Holiday Shop. And all the businesses participating will have a window display. So you'll see it on the door going in that they're part of the program.
So there'll be a big sign up.
There's a window display, absolutely. And there are lots and lots of yard signs plastered all over the Hamptons telling people. So it's the same visual. So just look for the sign and it will be there on the store.
And what color is the sign?
So I have brought some flyers here today. And this little shopping bag is the sign that you need to look for. And it will be on the doors of the participating shops. And it will be on the yard signs, it will be on the posters, and it will be on emails. We'll be emailing people out to tell them about all the businesses that are going to be included. And we have over 25 right now, and new ones are coming on every single day as more people hear about it.
And what about restaurants? Are there any restaurants involved?
So each village has a good selection of different restaurants and businesses and shops. So if we take Sag Harbor, for example, we have Urban Zen. Donna Karen is giving a big percentage back to the hospital. Gabby De Felice, her daughter, is doing a number of different discounts at the restaurant and giving back that way.
And what about places like Wolfer Estate? Are they doing anything to be helpful? I think they are. I think
They
you mentioned that if you buy special edition glasses,
Yes.
that
So I wish I had them with me, actually. They're not quite ready yet, but they are these beautiful holiday-themed glasses by Wolfer Vineyard Estates. And Joey Wolfer's shop is also participating. Everything in the store, she'll donate a percentage back. So Joey's involved, the vineyard's involved, and
excellent. And then all the liquor stores I heard were
Yes.
involved. And what about the jewelry stores in case someone wants to buy an engagement ring or something?
We do
Imagine that, buying an engagement ring and a percentage of the proceeds going to Stony Brook Southampton Hospital. That would be amazing, right?
It is amazing. We're hoping to have one of the big jewelers in East Hampton, because I should also say that the proceeds from retailers in East Hampton, and we have some wonderful, wonderful stores. We have Bonwy, we have the Monogram shop, we have Persico, we have J. McLaughlin, we have a number of them. And they are all donating back to the East Hampton Emergency Department Fund.
Excellent.
Because we're halfway to building, in terms of funding, halfway towards building towards raising the money to build the East Hampton Emergency Department, because we really need to have that facility out here for the residents further out on the East End, because the summer traffic. It's impossible to get anywhere.
Well, now it's impossible to get anywhere anyway.
Any time of year. So
especially at rush hour. And what about holiday decorations? If someone wants to go out and buy a Christmas tree, do we have any of the local places that sell trees participating?
We've spoken to some landscaping, some of the companies out here, and hopefully they will also be coming on board as well. And don't forget all the lovely boutiques. We have Kerner Zabet in East Hampton, which is a beautiful store, and a number of them. Joey's shop obviously has got lots of lovely, lovely items. So if you want to dress up a little bit this year, if you want to decorate your home, if you want to go out for dinner, order dinner in, however you want to celebrate, or buy a little gift for somebody. We have Hampton in June in West Hampton. So whatever you're doing, think about whether or not you can at the same time make someone happy, enjoy the season, and support your local business, your local community, and the hospital. So it should be a win-win for everyone.
It's very exciting. What about the car dealers? And then what about if someone wanted to buy a home or rent a home? Something to think about, right? If
I need to get you on board. I need to steal you for a couple of days.
I don't own a car dealership, and I'm not selling my home, but it would be so nice if some of the real estate firms were able to participate in some way, because real estate is such an important business here. And then also maybe the car dealerships for that special individual who's getting a new car this year, right?
It would be wonderful. And even if businesses aren't participating in terms of a percentage back, there are other ways to participate too. People can just make a flat donation,
which would be very nice. So we're giving our viewers some ideas right now, correct?
Absolutely. Or they can donate items. We're thinking towards the holidays, we may even be able to do a raffle or something of that nature. So if anybody would like to be involved, we will find a way to incorporate them and make their gift really worthwhile.
And what about people, if they want to do something for the employees of the hospital, going back to the idea of calling a restaurant or a sandwich shop, maybe the Village Cheese Shop in Southampton, and asking them to supply sandwiches, not for everybody in the hospital because that might be too expensive, but maybe for 10 individuals, department by department. Is that something you're recommending also? I think that would be a very nice thing. And I know it's fun, and people feel so good when they know they're helping. Here, we've had these amazing frontline workers doing so much. Well, let's keep up the momentum, right?
That's a wonderful idea. The meal train, the official meal train we had during COVID was the highlight of everyone's day. It was like, what's for lunch? What's for dinner? We're so grateful that people would bring things in. And towards the holiday, if you've had a good experience at the hospital, you really think about the overnight people. You think about maybe the environmental service people, or you feel the ER people. Anything that appeals to you. a small gift or a donation, or a like you say, takeout order, even a tray of cookies. The excitement that comes from just it appearing out of nowhere and it's very special. It means that someone's really thought about you and appreciates you.
So now if someone wants to donate food or go over to the Kate's Bakery or somewhere and get a platter full of cookies or bags full of cookies, who do we call?
Call
How do
me.
we do it? Well, and what is your communication or your line of communication that you can give to our viewers?
So we have call the foundation, and we will accept any ideas or any gifts.
Southampton Hospital Foundation.
Southampton Hospital Foundation.
And what is the website?
It's literally just Southampton Hospital. Well, if you go to the Stony Brook Southampton Hospital, go to special events, and you will find us there. So it's southampton.stonybrook.edu.
A little complicated,
but if
I
you
think
just
if you
Google
just type in
Stony Brook Southampton Hospital, it will pop right up special events, or call the main number and they'll put you through. It should be super easy. And you can ask me by name, and I will help you, and we'll figure it out. And I'll be happy to hear from you.
And then there's also a donate button on that website, correct? And you mentioned, well, if you've had a good experience at the hospital, but many people never even get to the hospital. However, in case you do get to the hospital, it makes sense to have a great hospital. So how do we do that? Well, we do that by supporting the hospital. And again, this is one way, donating directly is another way, and just whatever individuals can do. And I know that the community has been generous, but that generosity has to continue. Without a good hospital, a community cannot move forward and cannot survive. I've often thought about, well, wouldn't it be nice to have a home somewhere on some island, even if you're going on vacation, to go to an island, and if there's not a hospital and all of a sudden a family member were to get sick, well, it's very frightening. And all the more important when you live in a community to want to have a good hospital. So it's also very, very interesting. Now, let's hypothetically, we're now in 2021. What is the hospital thinking about COVID? Will it be over next summer, or is that an unknown that no one can answer?
Well, what we do know is that the Department of Health has contacted us to become one of the vaccination sites, so we're going through the registration process right now. So we are already preparing for that. We are also being prepared for the distribution and the correct tiering of that distribution, starting obviously with the emergency workers and working through the community. So we are already planning for that, which is good news. We also know there are 2 vaccines which are in which we believe the science is very strong, and it suggests they're safe. And hopefully we're looking towards the end of the year, the beginning of next year, for a 2-part vaccine, which will be 2 weeks apart. And at the moment, there are 2 drug companies that are looking very likely they'll very likely be able to provide it. You won't be able to switch. Once you start with one drug, you'll have to have both injections from the same manufacturer, have to be the same. You can't have one and then get the other one. You have to have the same drug 2 weeks apart.
And so now you mentioned this year, the end of 2020?
Possibly.
And moving into 2021. So that's actually very soon.
It is soon, I think.
And how exciting.
Very
to think
exciting.
that we'll have a vaccine and maybe we'll have a quick end in sight is really amazing. And then getting back to the flu shot, are you advising people to take a flu shot this year?
It's more important than ever. I'm so glad you brought it up. It's more important because of what's going on. We are actually doing a flu clinic.
At the hospital?
At the hospital. If people are interested, they should ring again or Google Stony Brook Southampton Hospital and get the number and call us.
So you can come right into the hospital and get a flu shot. And you can also go to your local drugstore, correct?
You can. And also, but it's best to call, because we are doing it by appointment, because we have to have our social distancing and make sure we keep everyone safe. So do call us, but it's very, very important. Absolutely.
Very, very exciting. And just to think that there's an end in sight of this pandemic that's been so devastating to all of us. And we have about a minute left. Mirella, what would you like to leave the audience with? And thank you again. You've been great, but what would you like to leave the audience with?
Well, I owe you a huge thank you for letting us come on and tell people what's going on and encourage them to participate in Hamptons Holiday Shop. But the final word is really from Dr. Weinbaum. It's like, I know it's been a long haul. People are tired of this, but please, please keep it up. Keep up the masks, the hand washing, the social distancing. It will keep you and your family safe.
And stay home more, right? And
yes,
but go to a few restaurants.
Just be very safe. Just be careful.
Be careful and be vigilant, and we will get through this. And
we will.
Well, thank you so much, Mirella. This has
you.
been just a joy, and you know how important I think the hospital is, and I think most of our viewers also feel the hospital is extraordinarily important, and especially now. And I think going through this pandemic, I've heard we may have future pandemics in our lifetime, and we probably will. So thank you for this invaluable information. Thank you for telling us about the Hampton Holiday Shop and how we can all get involved in supporting the hospital. And you've been a great guest. And
thank you. Thank you so much.
To all our viewers, this concludes today's Successful Philanthropy. I'm your host, Jean Shafiroff, and I hope to see you next week.